Thank you, Dr. Paul. My name is Antonio Armando. I'm Medical Officer for Integrated Service Delivery. I am a Lusophone, and with permission of Dr. Gatuma, I'm going to speak in Portuguese because she wants to improve her fluency in Portuguese. Thank you. It was requested.
I would love to hear your presentation in Portuguese, but unfortunately we don't have the interpretation today. So
Okay.
you could pick either English or French.
Okay, thank you. Yes, we was requested to present about the framework and the guideline for sickle cell disease. Firstly, it was my colleague Dile to present because she is a focal point for cancer, but she's abroad, she's traveling, and I'm going to present in her place. Next, please. These are my outline. I'm going to present about the framework and the guideline for cervical screening. Next, please. Yes, if we see the framework that was adopted in 2021, we have in the framework this content: the current situation, challenges, vision, objectives, goal, target, and milestones, and the priority intervention. These are the aspects that I'm going to present regarding the framework. Next, please. All of us know that cervical cancer is a public health problem, and the figures are showing. And if you analyze this data, we're going to see, for example, in Africa, 90%, Africa represents 90% of the incidence. And we know that Africa only represents 13% of the global population. And if we see in terms of mortality, 22% of mortality related to cancer is in Africa. The problem is, if we only represent 13% of the global population, why 22% of mortality is happening in Africa? We are going to see why. Next, please. These are the challenges that Africa is facing because we have low access of preventive service in the region, specifically screening, early detection. We have high operational cost for treatment of precancer lesion because we know that I think Professor Uzma is a gynecologist. He knows this kind of approach. We have high operational cost of treatment of invasive cancer. For example, I'm a radiation oncologist, and we know that to treat cancer, you have to have linear machine, you have to have brachytherapy, chemotherapy, and surgery are very high costed. And we have inadequate skilled human resource for cancer prevention and treatment. We need more people trained in cervical screening and treatment. We have inadequate infrastructure for tertiary level management because, as I mentioned, to treat cervical cancer, you need radiotherapy, you need chemotherapy, and you need surgery, specifically in Africa, where the majority of women are diagnosed in very advanced stage. Radiotherapy is essential because in some cases, surgery is not possible, and we have to treat with chemotherapy and radiotherapy, and radiotherapy is expensive. And we have a weak monitoring and evaluation system. We need data about the number of the incidence, the prevalence, and the mortality, and the intervention that we are implementing. Next, please. This is the, in this slide, I'm presenting the whole response, WHO response, not only WHO, but United States response to combat cancer. We have, for example, in 2011, the Hunger Declaration about NCDs, and in the same year, we have a Brazzaville Declaration. Brazzaville Declaration is a document where all of the member states adopted or are prioritizing NCDs as a public health problem. The big difference between the Hunger Declaration and Brazzaville Declaration, Hunger Declaration is including only 4 NCDs, specifically cardiovascular disease, cancer, diabetes, and chronic respiratory disease. But in the Brazzaville Declaration, we're including all the diseases like mental health, oral health, eye, sickle cell disease, violence, and injuries. In 2013, as a response of UNGA Declaration, WHO developed and published the Action Plan for Sickle Cell Disease. And in 2015, UNGA developed and published a Sustainable Development Goal. And in Target 3.4, we have a recommendation about NCDs, and the recommendation is to reduce the mortality related to NCDs by 1/3. 5 years later, because if we see, for example, the first global action plan was for 2013 to 2020, but to be aligned with sustainable development targets or sustainable development goal, the global action plan was extended to 2013. And in 2020, we up to date, or WHO up to date the HUPEN. We know that the HUPEN is a package that recommends to screen and treat NCDs in primary health care. But if we see, for example, the recommendations that are in the HUPEN that was adopted in 22, regarding the cervical cancer, the recommendation is early detection. But in global initiative for cervical cancer that was published 1 year later is recommending screening, because screening is different than early detection. I'm going to explain it later. And 1 year before, after, Africa region adopted the framework for implementing the strategy to accelerate the elimination of cervical cancer as a public health problem in Africa. Next, please. These are the vision, the goal, and the objective. For example, the vision is an African region free of cervical cancer as a public health problem. The goal is to ultimately eliminate cervical cancer as a public health problem in the region. And we have 4 objectives, as we can see. Vaccine for HPV, because we know that the HPV is the main risk factor for sickle cell disease. To increase the coverage is important, and I'm going to present in target, increase the coverage and success of diagnosis and management of cervical cancer, and strengthen the capacity of monitoring and evaluation of cervical cancer prevention and control for performance tracking. Next, please. Here we have the milestone for 2024, 2028, and the target. If we see, or if we analyze the initiative to eliminate cervical cancer, he's proposing that by 2013, 90% of girls under 50 must be vaccinated, and 70% of women must be screened. 70%, why? Because we have a strong evidence that when we screen less than 70%, it's difficult to reduce the mortality related to cervical cancer. But if we achieve the target of 70, it will be possible to reduce the mortality related to cancer. And the last one is 90% of women identified with cervical disease or precancer lesion and invasive lesion must receive the appropriate treatment. These milestones are very important because it's going to allow us to know where we are. For example, regarding the HPV vaccine, we have only 72 countries that introduced cervical or introduced HPV vaccine in the health system, but only 6 countries achieved the target of 90%. It means that we have a lot of work to do. Next, please. Here are some priority. If you analyze the document, there are a lot of priority, but here I'm mentioning only 5 priority. Assessing needs and mobilizing resources, because we know that without resources it's difficult to implement any intervention, develop and implement strategy to ensure sustainable supply of HPV vaccine, because as I mentioned earlier, it is needed to achieve the coverage of 90% of all of them under 15, improving communication and social mobilization for HPV vaccine. This is an important issue because some country, I have, for example, of my country, they are introducing the HPV vaccine, but some parents are saying, no, this vaccine is not good. Why are you recommending it? And some of them are rejecting. That's why social mobilization is very important. Developing and implementing strategy to ensure the sustainability supply of HPV vaccine, defining cervical cancer management package, how, for example, to screen, how to treat per lesion, and how to treat invasive lesion, and expanding service for the coverage. As I mentioned, coverage is important because in some countries the coverage is 10%. If you have a coverage of 10%, you are doing nothing because we have evidence, scientific evidence, but that if your coverage is low, you are not going to reduce the mortality related to the cervical cancer, because the objective is to reduce the mortality. Next, please. Here are the summary of the objective, the target, and the milestone of the framework as I presented. Next, please. Well, as I mentioned in my introduction, we was requested to present about the framework. Now I'm going to give some idea about the guideline. As I mentioned, we have a open, and in open we have 4 diseases specifically: cardiovascular disease, cancer, specifically cervical cancer and breast cancer, chronic respiratory disease, and diabetes. But the recommendation that we have in open that we are using now is about screening. It's not about the screening, it's early detection. The recommended is C and refer, but the recommendation of WHO initiative is screening. That's why this recommendation were up to date by HQ. Now at country level, at regional level, we are up to dating this recommendation because we are going to include them in the open, because we need to guide countries how they have to screen. This document was developed, was discussed, now is under editing. It means that in next 2 months we are going to train countries on this new guideline. And in this guideline we are recommending, for example, screening for DNA test, because DNA test is more sensitive and more specific, and they have strong data that are showing is a cost-effective and have a high impact, because the test is expensive, but if you can do in every 10 years, we are going to reduce the cost. That's why we are recommending this test. In countries that are using other tests, for example, VIA or cytology, the recommendation is to do the transition in the next 5 years. Next, please. Okay, this slide is to show that usually we are developing document, we are developing strategy, but we have action. Here in WHO, at regional level, we are supporting one project. We are supporting 3 countries in the project called WICS, specifically Kenya. A colleague from Kenya, I think that you know this project, Zimbabwe, and Cote d'Ivoire. Next, please. The goal of the project is to reduce the breast and cervical cancer burden through the early detection, screening, and treatment using integrated primary health care approach. As I mentioned, I think that our first speaker talked a lot about integration. What we are proposing, we are integrating all of NECDs. It means that all of women that are going to screen, they have to screen for breast cancer, cervical cancer, diabetes, and hypertension. And I think this is an opportunity to integrate, for example, for the disease.